Welcome to Uncovering Spirituality, where we embark on a journey of exploration and discovery into consciousness, energy, and the spirit world. Join us as we delve into the mysteries of spirituality and uncover the universal truths that connect us all. Hello, I'm Kathy Upper, founder of Spiritual Niagara. I'm also the consulting visionary and podcast host for Spiritual Canada. Joining me today is Maura Bommer, owner of Niagara IMT. Maura Bommer is Niagara's only certified IMT therapist. She graduated from the Connecticut Institute of Integrated Manual Therapy. She holds certificates in cranial sacral release, muscle energy, neurological anatomy and physiology, advanced biomechanics, myofascial release, concussion, PSD, and stroke therapy, and much more. Integrated Manual Therapy, or IMT, is a powerful healing tool which treats pain, disease, and dysfunction of all types. IMT is best described as a healthcare process, working with the body's diverse systems to uncover and address root causes of disability. Maura integrates IMT's holistic healing with her qualifications in health, fitness, nutritional counseling, Pilates rehab training, and post-rehab exercise design. This holistic, comprehensive approach is gentle and non-invasive, yet provides profound and sustainable results. Maura is excited to bring these restorative skills and talents to the residents of the Niagara region, the GTA, and Buffalo areas. Hello, Maura. Thanks for joining me today.
Hi, Kathy. Thank you for having me. I'm very excited to be here.
Let's start, first of all, with the origin of IMT. Not a lot of people are familiar with it, or integrated manual therapy. So maybe you could give us a bit of a background on it.
Yeah, of course. Integrative manual therapy was originally started in the 70s by Dr. Sharon Weiselfish Gimateo. And she was the head of physical therapy department at Mount Sinai Hospital. And she started actually in Toronto. Through her work there with physical therapy and osteopathy, she started to delve into alternative processes of healing the body and using its own propensity to try and heal itself. She then married Dr. Tom Gimateo, and together they added in nutritional counseling, homeopathy, chiropractic work, and just more energetic mechanisms that they can utilize to very non-invasively and gently get the body to heal itself by releasing some of the issues that the body might be under attack, attacking itself, like an autoimmune disease might be, or recovering from trauma, or genetic difficulties, that sort of thing. So it has really spanned quite a wide berth of dysfunctions over the decades.
Interesting. So, and how did you end up getting started in this?
Well, my background was in fitness. And through that, just realizing even at the gym, the somewhat aging population, I got into rehab and post-rehab exercise design. I am a Pilates trainer and became more skilled in therapeutic Pilates, as well as athletic versions of that. And through that rehab aspect, I realized that there can be more to people's healing other than exercise alone. And clearly, diet and exercise can positively influence anybody's healing, no matter what the situation is. But oftentimes it it can't be just a one-off type of one-off situation. It's got to be a continuum, and a lot of times other interventions are absolutely necessary, especially with bigger ticket items like cancer, neurological diseases, yeah, like I mentioned, autoimmune, anything like that. So I came across both Dr. Sharon and Dr. Tom in Toronto when they were presenting at a conference. And from there, I connected into their institute in Hartford, Connecticut. And I spent 4 years at school in Hartford, and since then have done graduate courses in various modes and new techniques and technologies that have come up. So I started in 2009, and then here we are today, and I've been still on that learning curve.
Oh, yeah, so you've been doing it for a while. And it sounds like with all that training in terms of, fitness, you've got a really good background in kind of the physiology of the body as well.
Absolutely. That's, quite often the physiology and the movement patterns or lack thereof will lead a therapist to where dysfunctions are actually located. And I'll give you an example of that. If somebody has a sore back, they're not going to be able to bend forward easily and touch their toes. Now, their back might also be dysfunctional without it necessarily causing pain, but then the result would still be the same. The function of how the back should move will not be available to them if the back is not functioning properly. Do you understand what I mean with
Yeah,
that?
right.
And then once looking more at the limitations of movement, it'll often direct you towards where the problems actually lie.
Yeah, so looking at how the body moves, you can kind of judge get an indication of where the issue is.
Yeah.
Yeah,
And some things might not be evident for the person themselves
right.
as we start. They might not realize that, oh, well, I cannot touch my toes, but physiologically, the way that the body and the spine is built, we should all be able to do that.
Yeah,
And that might be a far concept for some people.
yeah. Yeah. So tell me, what does somebody experience with an IMT session? Like what are you doing? Like what is the patient or the client doing?
Well, during a session, most often the client is just laying down. They are fully clothed and they're made very comfortable with pillows or blankets or whatever it is necessary. Um, in general, I prefer not to work with, jeans, belts, parkas, shoes, those kind of things. So, kind of like sweat clothes, or workout clothes or yoga clothes or something. But there are clients who cannot lay down. Some people cannot lay down on their backs, for example, which is the most common position that a person would be in on a sort of massage table. But there might be a wheelchair person, and you can't just ask them to get up and get onto a massage table. So we do have a term that says meet people where they're at. And therefore, because the physiology of and the energetics of the body work in any position that a person is in, therefore, if they need to stay sitting or if they need to be lying face down or, whatever position that they are most comfortable in, that's how we work. And so just by virtue of the name itself, integrative manual therapy does indicate that it's a hands-on treatment, but it is very gentle in the sense that we're not like chiropractic work where we're trying, or maybe fascial stretching or some other modalities where we're trying to get the body to move beyond its limitation. We're always making assessments of very gentle tissue responses, and those can have tension patterns in them. And as soon as we find a tension pattern, then we back off of that just a little bit. So often a person doesn't necessarily feel something, but often after a session is done, they will feel changes overall. And that can really vary between one person and another. And it can also vary just dependent on what we're working on. I have had some patients, for example, somebody who had a bad bone fracture or a couple in the foot. And as I was working on that, she would experience, intermittent, I feel tingling in my knee, or actually that went all the way up to the shoulder, that sort of thing. So sometimes things can be quite distant from where you're actually working, because energetics in the body, everything in the body travels throughout the entire body. It doesn't shut off. The circulatory system, the lymphatic system, the nervous system, they don't stop at certain areas. They travel throughout the body. And so it's not unusual to feel things in a different location.
Yeah. So yeah, everything's interconnected, right? Yeah.
Absolutely.
And the person's
Yes.
not moving at all, right? So they're lying or sitting or whatever in a comfortable position.
Well, it depends. Sometimes we do want to test range of motion, and then we document how their motion is affected or not. But also there are certain techniques, like there's a particular technique called strain counter strain, which is an osteopathic concept that was developed by Dr. Lawrence Jones somewhere in the 70s, where it's almost the opposite of stretching an area. So if somebody, it's very common if somebody was tight in their hamstrings, let's say, which is the back of the leg, often they would go through a stretching program, and or a physiotherapist or what have you, who would put them on a sort of put the musculature on stretch. But I will talk about a concept of protective mechanisms. If the problem is not within that muscle specifically, then the muscle, it's the hierarchy of the body has already determined that the hamstring should stay in a tightened form in order to protect the hierarchic structure that it's trying to work with. And therefore, we don't want to stretch things that are already in a protective mode. But what we do is with strain counter strain, we actually put that musculature on slack in order for the fibers to reorganize and realign themselves. And it will allow that particular muscle to release in the capacity that it can. It will not override its job that the body itself, the higher functioning areas of the body, has dictated for it. It will not, IMT will not override anything that the body needs to do to protect itself. And yet, sometimes it gets into these tension patterns that aren't really necessary anymore. So if you let it make the decision itself and put the muscle actually on slack instead of on stretch, it has that opportunity to reorganize, realign its fibers, and to release itself, rather than me as a therapist doing, air quotes, something to it. Does that help?
Yeah, so
in terms of
it sounds to me like what you're doing, so with this hands-on therapy, is you're kind of communicating with the body. Like that's what it sounds like to me. Like you're saying, it's okay, it's okay, it's safe for you to release now, or something similar to that. Is that kind of
Well, that might be the case, but I don't necessarily know that. I cannot say. So let me get into a couple concepts about how this might work. And so I'm going to backtrack a little bit. And what I had just talked about was this one particular technique of strain counter strain, because you had asked that does the person actually do any movement at all? And with strain counter strain, yes, I would potentially put a person in a particular position in order to allow either that muscle, and I just use the example of musculature, but Dr. Sharon had actually extrapolated that original concept to not only be used for musculature and bone, but to go into any of the systems, because they all work physiologically in a similar way. So if we could use strain counter strain on a muscle and having success, then we can also use it for an organ like the liver, or for a different type of muscle like the heart, or for anything in the nervous system, which is neural tension release. But that's only one of the techniques. So what I would, I think it's better to lay more of a roadmap of how IMT works in a very general sense, as opposed to getting into specific techniques, because there are really more than 20,000 interrelated techniques, and we surely don't have time to get into all of that today.
Right.
So just to kind of rein in the concepts, I'll talk a little bit about how IMT works more globally, and that might be a little bit more interesting for the audience. So one of the concepts are like blockages. So a lot of energy work, but also physiological work, works with blockages in the body, and I'm sure a lot of other modalities use that. We often work with drainage. What are we actually not able to release and get rid of through our routes of elimination, that might be creating difficulty and dysfunction. And also differentiation. And I think this is where differentiation is a term that really sets IMT apart from other modalities. But I'll get into that in a moment. So as far as blockages go, I mean, very physically, a person might have blockages in the brain, which would be a TIA, or a stroke, which is a trans-ischemic attack, where the blood actually gets blocked in one of the arteries going into the brain. And with a TIA, it's fairly short-lived, but with a stroke, it's a bigger process. So a blockage would be, in that sense, where is something supposed to flow and it's not flowing, and how can we correct that? But that can also happen energetically, or it can happen anywhere in the body. It could happen in the ankle when the ankle swells up, or it can happen in the heart when we're under a heart attack, that sort of thing. So trying to discern where there are blockages that can happen any place, and what is it that's actually being blocked, and can we release that? And the second concept being drainage. What is it that we can release, but we're not really actually draining out? And I think for anybody who's had a sinus headache before, or has suffered from sinus congestion, I think they understand what that concept is. Sinuses in the head are referring to air pockets, but they also, for whatever reason, they refer to the veins in the head are often called sinuses as well. Straight sinus, transverse sinuses, those are all veins in the head. And it's through those veins that the air pockets that are around your forehead, between your eyes, your nose, the maxillary sinus, the ethmoid sinuses, those get blocked when people have sinus headaches and problems with allergies in the springtime, for example. And if they can drain properly, then the headache and the pressure relieves itself. But the way they drain are through the vascular sinuses, which all drain into the jugulars at the neck. So blockages will prevent drainage. And so blockage can be something that's going in, like blood going into the brain, but also sinuses, or another situation, just draining out, in this case of the head. And the other concept that I would just refer to as a general concept is differentiation. And differentiation is to understand what direction are we actually going in. And it's gaining and enhancing clarity in the body. So let me put it this way. The body works sort of like a corporation. And in every corporation, you have the president and the CEO, you have the finance department, you have the marketing department, you have the purchasing department, you have the cashier, and you have the stock people who are restocking shelves, let's say, that sort of thing. Now, if each person in that job function, in that corporation, understands their job function, it's very clear what they need to do, they can actually interface with another department and work much more efficiently and effectively. So I think that's probably pretty clear on how that would work. If, for example, the janitor did not show up to work and the toilets overflowed, it'd be really hard to ask the finance department to go clear up the plumbing so that the toilets were not overflowing. And the finance department people might say, well, we're doing finances. We don't know anything about how the janitor works. And yet, if the toilets are blocked in the finance department, it's definitely going to affect how efficiently the finance department people work. They might need to use a washroom elsewhere and leave the building, that sort of thing. I'm personifying things and trying to simplify it. But if people are clear about their function and what their job description is, then the marketing department could easily work with the purchasing department so that they can line up, interface well with each other, create a marketing campaign that they actually have supply for. Does that make sense?
Yeah. So all
The body actually works in exactly the same way.
all the
Each
different
thing that
systems.
so each component of our body needs to be able to interface and work with another component, but it also needs to have clarity and for it to function efficiently. So the differentiation is to understand where that clarity is lacking. So for example, like I mentioned before, back pain, if I, as a therapist, can discern, is this actually a problem in the mechanics of the back? Or through the hands-on therapy, if I can differentiate, is there proper blood supply? Is there proper drainage? There might be toxins through the intestinal tract that are swelling up the gut, that are backing up onto the spine, that are holding the spine still, that is not allowing free movement and causing pain and dysfunction, that a person cannot bend over and touch their toes because their back and their intestinal tract might be lined up. So the clarity would come in to differentiating the functioning of the spine, whether it can bend forward or back, in reference, in this case, to the intestinal tract. And is it the back that's interfering with the intestinal, the GI tract, or the other way around? And understanding how they interface with each other. Because we tend to think of things very two-dimensionally and not working with other systems within ourselves. But the body does have this terrific hierarchy that will stop the back from bending forward if it's going to do a dysfunction to the intestinal tract, for example, because the intestinal tract, the GI tract, is more important than the back bending forward.
Now,
and I can give you.
Can I ask?
Oh, go ahead.
I'm
of course.
really interested in how, how do you sense these things? Like, what are you feeling? I guess it is like it's your hands, right? You're using to determine this, right?
Yes.
What are you sensing or feeling when you're doing the session?
So this also comes into play. The answer to that comes into the clarity and the function come into play, because each component of the body has a different sort of frequency or energy motility to it. And it's a matter of understanding what that feels like, that gives you information as to what is working or what is not working. So it was explained to me a long time ago, like, it's almost like changing the channel on the television. I mean, old school was we had to walk up and physically turn the dial to get a different channel on the TV, but you might like also see that as the radio station. The frequency that a particular station is operating at is only its frequency. It cannot operate under a different frequency because that's assigned to a different channel. And therefore, that having the experience of understanding what the different frequencies are, and that can get to something very broad, like the quadricep muscles versus the hamstring muscles. How they move and what their frequency feels like are different from each other. And therefore, I will get information. But it can also get very specific too, whether it's the circumvent artery in the heart or the lateral articulating artery in the heart. I can differentiate, knowing and understanding how the heart works and what those two particular structures are, which one is possibly not functioning well. But that might lead me back to something different. It could lead me back to the valve system within the heart. So I have to understand, where is the mitral valve located? What is its function? And how does it operate? And in reference to some of the other valves, like the aortic valve or the tricuspid valve or what have you. I don't need to get into so much detail, but it's just to give you the sense that the anatomical structures that are actually there in the body operate on frequencies. Those frequencies all have energetic patterns. Once you understand what the science of the physiology is, you can uncover what the energetic patterns are. And when you know that you're on a particular structure and you don't feel any frequency, or sometimes we do feel aberrant patterns or aberrant frequencies, then we know that we're on the right track. And a lot of times we can cross-reference with other points to make sure that we're on the right track. Now, if that mitral valve is not operating properly, there's nothing I will do to override what it needs to do in order to protect the heart as a whole. But what I can do is give it some other choices. So particularly when you get to structures that are that important, the heart, the brain, you want to give the body the opportunity to release some of the blockages, to open up some of the drainage, and to also find clarity and differentiation from its neighboring structures, to give it a choice. Do you really need to hold this back to the extent that you're doing, or can you release a little bit and still be protecting the global or the overall structure that you need to protect, like the heart functioning?
So you're in a sense, working with the frequency that you're feeling the frequency that the body is giving, right?
Yes. Yes.
And you're trying to tell it maybe to do something different. Is that?
I don't think I would use the word tell it. I would ask it. Is it possible?
Okay.
Is it possible? And would you feel more clear in your job if you fill in the blank, if you ... if you release this blockage, if you increased blood flow? And so that will also get me into a concept of dowsing, that we use dowsing often. And it's something that I personally use quite often, because now people may have heard of dowsing when they are using maybe looking for metal on a beach or looking for water on a land area. It's been used for centuries. And dowsing is also energetic frequencies. And when you have dowsing rods, they react a particular way when they find whatever it is that you're looking for. If I use dowsing rods for water, I doubt I'm going to be able to find a gold ring in the sand, because that gets me back to the channel and the frequency, how a dowsing, and I haven't used dowsing rods, so I don't know exactly how they work. Let me clarify that. But my assumption is that if a dowsing rod is meant to find water, it's not going to find metal. So each channel needs to be utilized for its own frequency, and it has its own frequency as a particular pattern. But a lot of times we can do what we call a 2-arm or a 1-arm dowser. Whereas if I have my hand, let's say in this case, on the heart, on the mitral valve, and I'm trying to douse, I can actually internally or sometimes verbally just ask the body, or not that the person themselves intellectually is going to be able to answer me, but I can ask energetically, is there something else I need to know here that's affecting how the function of this mitral valve is working? And I might get an answer that is related to the heart, like maybe that there is some kind of disruption or loss of integrity through the superior vena cava that comes into the atrium and therefore affects the mitral valve. Maybe I'm going to get something like that. Or it might be something that's way different, like somewhere else in the body. Probably it has not come up with me that often that it's been asking something in the heart and it's coming up in the hand. But it's possible because everything in the body is interconnected. But I would go to the hand and see if those two areas, in this case, or maybe the SVC, the superior vena cava, if that was the answer I got as a dowsing project. And I would see if those two frequencies seem to line up with each other, that they react to each other, and then I know I'm on the right track. So for me, whenever I ask the question, I always have to respect the answer, even if I think it's something absurd.
Oh, neat.
It doesn't usually come up that often, but
your intuition coming into play with this as well?
Absolutely,
Yeah.
absolutely. But and the thing is too, and I think this is also important, is that every person alive, I'm going to say in general, all things being equal, every person alive has this capacity, but they do need to recognize it and they need to experience it and work with it and trust that they have the intuition. Like, let's say a mom and a child, if she sends her kid off to school and then she thinks, there's something going on. I don't know what it is, but she gets this little inkling. That's an intuition that every mom has ever had with every child. And sometimes she might bypass it, or sometimes she's learned, I better follow up and make sure that my child got to school okay, or that he's not sick, or maybe, something didn't look right with her when she left, but I'm not really sure. Maybe I should follow up. Like every person has an intuition, has the capacity to douse. And for dowsing specifically, I was given an exercise that you put a tablecloth out and you have somebody put a quarter, you close your eyes and someone puts a quarter down on the opposite end of the tablecloth. And I start just very slowly drawing that tablecloth to me and seeing if I could discern where the quarter is lying. Is it over on the left corner? Is it smack in the middle? Is it somewhere closer to me on the right side? I have no idea, but I'm trying to douse, and it's an experiment to try and practice this, get a sense of what things are lighting up. And I'm going to use lighting up in air quotes because it will give you information that you're looking for. But you have to ask the question and you have to be willing to accept the answer no matter what it is.
Neat. Yeah. Actually, we're just looking at the time. We only have a few minutes left. What do you think people should know about IMT in terms of how it might be able to help them?
Okay, let me leave you with a story and then I'll close it out that way. I'll close it up at the end. This is a true life situation. It did not happen with me as a therapist, but it was a good friend of mine. And I always remember her telling this story when I was first getting into IMT. There was a young boy, 12 years old, playing soccer. He kicks the soccer ball and he falls and he goes limping off of the field. And the coach or whatever said, oh, he pulled his hamstring when he went to kick the ball. So he went on about his day, but he has a lot of pain in that hamstring and he's starting to limp. And so in the course of the next day or so, his mom takes him to the doctor, takes him to the physiotherapist. The physiotherapist starts stretching the hamstring because the physiotherapist sees the hamstring is really tight. Before too long, and I don't know what the time frame is, doesn't matter, the kid is limping, then he has a crutch, then he has two crutches, and then at a certain point, he's in a wheelchair and he can't walk. And they're really concerned about what's going on with this because all he did was kick the soccer ball. Push come to shove, this kid sees my IMT therapist friend, and she puts her hand on him and says, I see that your hamstring is really tight. It's really locked up. It's very painful. The problem is not the hamstring. She was doused to the bladder. And what happened, for whatever reason, is when he kicked the soccer ball, he put a tear in his bladder. Now, the body, having its hierarchy, realizes I cannot allow urine to just be freely floating throughout the whole pelvic bowl and into the abdominal cavity. So I'm going to pull in, using my hierarchy, some of the other structures. The first thing it pulled in was the hamstring, which tightened up, and it made walking difficulty. Every time somebody tried to open up the hamstring, it got worse and it looked to pull in other structures. It took her 2 IMT sessions to use her hands, re-establish the integrity of the lining of the bladder so that the bladder fibers could line up, close itself, and the kid was walking fine after 2 sessions. So there's a real life situation that happens. I'm not saying if a person comes and gets on the table with cancer, it's going to take 2 sessions and they will be cancer free. I would never, ever say that. The body needs to heal itself. And all I'm there to do is to facilitate, no matter what it is, to help the body reorganize and realign itself. Because the most important job our body has is to keep itself going. And I'm just there to help it do the best job it can to keep itself working as long as it can, as efficiently as it can, and with as minimal amounts of pain, dysfunction, discomfort as it possibly can. And that's my job. And with every session, there's some changes that occur, and it's that pathway to getting to work more efficiently, more effectively, and pain-free.
Wonderful. It's fascinating, actually, what IMT can do and the processes. I know with my own sessions that I've had with you, I've always felt better after the session, and more in kind of a state of relaxation too. So I always appreciated that. So can you tell me, or let's tell people where to find you? We know that, of course, you're located on the Spiritual Canada website, but
Yes.
where else can people find you?
Yeah, I think I could direct people to my website, which is Niagara IMT. That's Integrative Manual Therapy, NiagaraIMT.com. They can always email me, which is probably the most direct way to get a hold of me. That's Maura, MAURA, at NiagaraIMT.com. And they can also find me on Facebook, Instagram, and some of the social media, and always direct message me that way.
Well, thanks so much for your time today, Maura.
Thank you. Thank you so much for having me. I really appreciate it. And reach out anytime.
My thanks to Maura Bommer with Niagara IMT for joining me today, and thank you for listening in. Be sure to subscribe to us on the Spiritual Canada YouTube channel. You can also follow us on Spotify or iTunes. Until next time, I'm Kathy Upper, and this is Uncovering Spirituality.